You are recorded. So for those of you that did not have a chance to not share your screen before you joined on, we saw your natural look. So it's okay though. We love you anyway. Still some people trying to join in. So thank you again for joining us on this virtual presentation week. We are already halfway through the presentations, which I can't believe we're saying that right now. So today we have Dr. Shula Jaron, who is going to be sharing her presentation. Anthem Health Keepers is our keynote sponsor that's going to be speaking today. Michael Hall, my brother from another mother. But before we let him share that, we're going to again announce and thank our sponsors for today and for this presentation, because again, without them, we would not be able to have this conference. So our supporting sponsors are Virginia Assisted Living Association. We have a few members here with us today. Senior Living Guide is a supporting sponsor as well. We have Gen Care, Senior Medical Center, Bayada Home Health Care, Aegis Sciences Corporation, Commonwealth Senior Living, Mako Medical, Carlton Building Services, Comfort Keepers, Morrison Living, Prime Plus Senior Center, and National Physiatry. And we do have a representative from National Physiatry on the call today. Next Chapter of Virginia is our silver sponsor. Our gold sponsor is Caption Call. We do have a member here that is on our gold sponsor today. And then, of course, our last but not least and most prominent keynote sponsor, Anthem. Again, thank you, Michael Hall. And with that, I'm going to turn it over to you, and I'm going to mute myself, sir. Better Micah talk.
He just always add the cherries on top. That means I owe him money next time I see him, just in case y'all didn't know that. Good to see everyone again. Happy, I call it Friday Eve, one day before our weekend approaches, and time just seems like it's flying already. We're headed into March. Just seems like we said Happy New Year. I'm sure it'll be Thanksgiving time before we know it. But definitely an opportunity, a great opportunity to be here with you today, to be able to witness this great historic event. Still hats off to Micah Hunt for being able to pull this together. There's a lot of work that goes on behind the scenes, a lot of sleepless nights. So I'm grateful to be a part of this. I'm glad that Micah reached out to me to be a part of such a great event and to have such the wealth of information that's being shared over these past few days. I took a lot away from yesterday, from Doug Pace and also from James Lee, from those two presentations. Very informative, a lot of things that I can add to my personal life, especially dealing with family members that deal with Alzheimer's. But on the light end of that, I am the director for the Medicare sales for Anthem Health Keepers for the state of Virginia. Been with Anthem going on 6 years, it would be in March. A great company to work for. Tons of employees, over 64,000 employees, over 40 million members, touching a third of our members here in the United States. Just a great organization to work for. But most importantly, I had the blessing to work on the side where we touch the lives of our seniors. And I can't say that enough. I started my journey with Anthem in the senior world with the Medicare, Medicaid demonstration, and was fortunate enough to be able to transition over these past few years into the Medicare division and still been able to work with our seniors. Most importantly, just to see the dynamic of how Medicare has changed, that never offered opportunities that focused on the dental and hearing, some options that were not included on the Medicare side. So we have a team of experts statewide, all the way down from Wise to Lee County, over to where I live in the Chesapeake, Virginia Beach area, all the way up to Northern Virginia. We have experts, Medicare benefit consultants that educate our communities on what Medicare is about. So I know Michael will be sharing email addresses when this is all said and done. I do encourage you, if you do have any questions, whether it be for you, your family members, it can be for any community, feel free to reach out to me. I have experts in every area of the state of Virginia. We have a team that covers the entire United States in the cities that you reside in. I'm sure that we'll be able to help regarding any questions that you may have regarding Medicare or Medicaid. So in saying that, thank you, Micah, for the opportunity once again to be able to say thank you to be here. Definitely a blessing, and I look forward to our presentation today from Dr. Jaron. Sure it's going to be a wealth of information, so I encourage you all to stay tuned and take notes, and I will sure, I'm sure I will receive my part out of this presentation today. Thank you.
Thank you, brother. Man, that's a hard thing to follow up. So without further ado, She allows me to say Shula, but I'm going to say Dr. Jaron. And I'm going to let you take over the screen and share your presentation. And everybody just please hear from Dr. Jaron.
Great. Can you hear me? Sound working okay? Awesome. So first of all, I just want to say thank you to Micah for inviting me to come and present to you all today. And thank you all for being here and attending and to listen to what I have to say. And so I really appreciate you all. And hopefully we'll have time at the end for questions if you have any. So I'm going to tell you today a bit about what we have learned over the last year about how surface testing can be a part of infection control in long-term care. And so I'm going to start my presentation telling you just a bit about myself and about the company that I founded. And then I'm going to sort of recap a little bit about what we already know about COVID. And then I'm going to tell you about the things that we've learned over the last year, just so that you have an idea of what's coming. So my name is Shula. I am a co-founder and the CEO of a company called Enviral. We're located in Eugene, Oregon, so on the other side of the country from all of you guys. And what we do is we test buildings for pathogens. And we're really interested in and focused on infection control using surface testing to identify and prevent the risk of a facility from getting an outbreak of a pathogen in that facility. And we were the first company who offered environmental COVID surface testing as a tool for the early detection of the virus inside of long-term care. And we are really passionate about surface testing. We believe it's a really important part of infection control because it allows facilities to have visibility to something that is otherwise invisible to them, so that they can see what's going on inside their buildings and identify whether they have a risk of an outbreak in that facility. And I'm going to tell you just a second about how what we do works. So we actually don't do the testing. We don't do the sample collection rather ourselves. We actually have created a very easy kit to use. The facility collects the sample inside the facility. They ship those samples back to our labs. We test them in our labs and return results within 24 hours so that the facility knows what they're dealing with, if anything, in their facility. And if the facility comes back negative, we actually return a certificate that they can hang in their facility to sort of celebrate the fact that they're negative. The type of testing that we do, we work with our facilities to test on a regular basis. So they're testing on a weekly basis for pathogens so that they have a visibility on a regular basis so that they can see how things are changing and how things are working in their facility. So that is what Enviral does. And COVID obviously has been one of the main pathogens that we've been testing for the last year for obvious reasons. And we all know that it's had, a pretty profound impact on our society. In less than a year, more than 500,000 Americans have died from COVID. That is more than World War I, World War II, and the Vietnam War combined. It's been pretty impactful. And we also know that it's going to be with us for a while, that COVID, even with the vaccines, that it is very likely that it is going to join the other types of transmissible pathogens that we've been dealing with for a long time, that we are going to be having to, on a yearly basis, consider how to prevent COVID, along with influenza, along with norovirus, along with other pathogens. And, sadly, 93% of the deaths in the US have been people over the age of 55. And that is disproportionately hit senior care facilities. So these are all statistics that I think you are all keenly aware of. And it is why we have been so passionate about ways that we can help prevent COVID and other pathogens in senior care facilities. And we know that COVID is transmitted via airborne means. And so this is a graphical depiction of a outbreak that happened in a restaurant in China. And colleagues of mine from the University of Oregon studied this outbreak, which started with a single COVID positive person and ended up infecting at least 9 people within this restaurant. And what they found was that the primary reason that these people were infected was because of the airflow in that restaurant, that there was an old HVAC system, it didn't have filtration on the system, and there wasn't enough outside air coming into the facility to dissipate the COVID particles in the air. And so since COVID is transmitted via airborne means, these are really critical, important aspects to how we deal with being inside. And this is very relevant to long-term care, because we are dealing with transmission of this disease inside a building. And so what can we do? The things that we've learned that we can do to help prevent and protect people inside buildings is to make sure that we have modern HVAC systems, that we are using filtration on our HVAC, and that filtration can be integrated with the HVAC. We can also use portable filtration systems, that we reduce the amount of recirculation of air, because we don't want to put back into a room air that has COVID particles in it, that we want to bring in as much outside air as possible. And that we know also that humidity plays a role in the infectivity of COVID. And so maintaining a humidity level of somewhere between 40 and 60% is important in lowering the infectivity of that virus. And so all of this is information that we are starting to really understand about the virus, and it's really important. And it sort of begs the question of, if it's airborne, why are we testing surfaces? So we test surfaces because surfaces are actually really great collectors of particles in the air. And you can imagine that as a person exhales or coughs or sneezes, that those particles stay in the air for a certain amount of time and then fall out onto surfaces. And those surfaces tell the story of what is happening in that space. We can even tell the story of not just a single person in that space, but we can tell the story of everybody who's been in that space, because the surfaces are collectors of everything that's exhaled from those people. And interestingly, surfaces have memory. And so unlike some tests that we do where we get a snapshot in time of what's happening at that moment, surfaces collect everything on them for some length of time. And so there is an amount of history that we can learn from a surface about what has happened within that facility. And so why are we testing buildings? Well, I told you that we are concerned about long-term care, that people in buildings, that we want to make sure that the air in those buildings is being maintained in a healthy way. And so we're very concerned about buildings. And so why test buildings as a tool? And really it is because we want to avoid outbreaks in those buildings. We want to help create healthy buildings so we don't have outbreaks. And so this is another depiction of an outbreak that happened in South Korea, where a single person who became symptomatic on February 22nd ended up infecting 45 people within that building on 2 different floors of that building. And you can imagine if there was some way that we could have stopped that person from ever going into that building, or even stopped the infected person number 2 from going into that building, then we could have prevented a very large outbreak in that building. And what I'm going to tell you in a minute is that we can actually, by doing environmental testing, and specifically surface testing, we actually can get a view before people become symptomatic. So we could have stopped these people from going into that building and infecting 45 people. So we have been, my company has been actively testing facilities on a weekly basis for almost 11 months now. We have tested we primarily focus in long-term care. We've tested facilities across more than 30 states and across the entire continuum of senior care. And that has amounted to about 50,000, more than 50,000 surfaces having been tested in that time period. And so we have a lot of data that we've collected, information that we've gathered, lessons that we've learned, and we're still learning. So we're still analyzing this data, trying to understand more about how we can help with infection control and what we're learning from COVID about infection control. And as I mentioned, many of these facilities have been testing with us on a weekly basis for months on end. So we have a longitudinal snapshot sort of how their facility has changed and improved over or not over that time. So one of the first things that we did was we looked at where in a facility should we test for COVID or for other pathogens. And we did that by looking at a marker of a human marker, a sort of general human marker that would tell us where in a facility there was human activity. And you can see that in the blue line on this graph here. So that tells us where we're detecting humanness. And then we overlaid that with looking at where we're detecting COVID-19. And what we found is that there's a strong correlation between surfaces that we detect a lot of human marker and surfaces that we detect a lot of COVID-19 marker. And what that says to us is that first, that we should be focusing on surfaces in high traffic areas where there are people. That's not so surprising. And the second is that we can actually use this human marker to help us select surfaces, to look for those surfaces that collect humanness on them, because that's going to correlate with where we're going to find COVID. We also found that when we detect COVID on surfaces, the higher the level of COVID that we detect, the more likely it is that that facility has an active shedder in it. We wanted to look at also how many surfaces do we need to sample from in order to have a high likelihood of detecting COVID if it's in a facility. And what we found is that if we collect, even with knowing the right surfaces to collect from, if we collect from only a single surface in a high traffic area, that we have about a 25% chance of finding COVID in the building. But we can increase those odds by collecting samples from more than one surface. And we can actually, what we found was that if we actually collect from 8 surfaces, we have a 90% chance of detecting COVID if it's in a facility. And so we have recommended now for many months to the facilities that we work with, that we collect from 8 samples in a high traffic zone to understand whether or not they have COVID in their facility. And we also found that COVID particles can remain on surfaces for many, many days if there is no cleaning and disinfecting involved. And so that tells us something about the history of the surface and the facility. We can tell whether that facility has been cleaned. We can also tell whether they've had an active shedder in the past. So what the facilities that we work with have ended up doing is they've ended up using the surface testing as an integral part of their overall infection control process. And they've sort of made it the bread of a sandwich, I think I'm going to say, is that it becomes the infection control process has many pieces to it. And the testing kind of is the first part and the last part for them. So the first part in the sense that they can look and see what is happening within their facility. And the last part is they can look and see how their infection control processes are working. And of course, the infection control protocol involves many different things, PPE, social distancing, checking to see if people are symptomatic, the cleaning and disinfecting, and all of those together, they've layered in this testing as part of that. And as a first layer of defense, what we have found is that we can detect COVID on surfaces up to a week before it's detected, up to a week before people show symptoms of COVID. And so I'm showing here is in the blue line, this is the average COVID positive surface across all of the facilities that we've been testing in over time. And so there's weeks on the bottom and the percent positive along the side here. And what you can see is that early on, and this is in about the July timeframe, we saw an increase in COVID positive surfaces. And then we saw another increase in about the late September, early October timeframe. And what you see in red is actually the CDC human positivity rate across the US. And you can see that lags the surface testing results by about a week to 2 weeks. And you see the hump that we know about that happened in August, and then the one that happened in sort of October, November, December timeframe, the increase. So the surface testing, if we just compare it to the CDC rates, is actually giving us an early indication of what's going to happen in the community at large. And that's kind of the macro look at how surface testing is telling us something. If we look at a more micro level, we actually have seen this borne out time and time again in the facilities that we've been testing. So we have a facility here that had been testing on a weekly basis. They had been negative week over week, and then bam, all of a sudden they turn up positive. And in all that time, they did not have a positive person, or not that they knew of. But that positive environmental test actually gave them a reason to go and test the people within their facility. And they in fact found that they had 2 COVID positive people who were asymptomatic. So they isolated those 2 people, and then a week later, both of those people became symptomatic. So what that did for them is that it actually gave them a week's heads up time to take action and make a difference. And so again, this is just demonstrating again that the surface testing was able to give a week's notice to what is happening inside that facility. And if we look back at that South Korean example that I showed you earlier, if we had had anything similar, so if we'd even had a couple of days heads up notice prior to that first person becoming infected, we could have easily prevented, and even a couple of days notice for that second person becoming symptomatic, we could have easily prevented that entire outbreak that happened, that 45 people outbreak, by removing them from the facility. So really, this testing data has provided those facilities with a way to take action. Because what they're finding is that a positive surface test is an indicator that they have an infected person in their facility. They can use that to contact trace by looking at the surface and saying who might have had contact with that surface. And then by identifying those people who had contact with that surface, prevent further cases by testing those people and identifying those people who are positive for the virus. And we've seen this time and time again. There's a quote at the bottom of this slide that I like to share from one of the companies that we've worked with for a long time, where they continue to see that testing has given them early visibility. And then many of the facilities have also layered this in as the last layer of defense. So they've used it to identify when there's unknown positive people in their facility. And they've also looked at how can we use this to assess how our infection control processes are working and to confirm the effectiveness of those. And so they're, in that case, they're just saying this is data that tells us whether the procedures that we're using are actually keeping our buildings healthy and clean. This is the graph that I'm showing you here is an early set of data that we performed looking at some very common chemicals in cleaners and whether or not they remove COVID from surfaces. And what we found is that there's a difference. There's differences in the effectiveness of those different cleaners. And we've also seen that there's some other parts to cleaning and disinfecting that make a difference in what we detect. So unfortunately, bleach is the best cleaner to remove virus from surfaces. It's not, we don't often love to use bleach. We're currently looking for alternatives to bleach that'll be as effective as bleach for removing virus from surfaces. We also have found that wiping is extremely important to actually remove the virus from surfaces. So just spraying, fogging, or doing other types of disinfecting is not sufficient to remove viral particles. That wiping is really necessary to remove viral particles from surfaces. And finally, what we have found is that data gives people peace of mind, so that by being able to see the effectiveness of the procedures that they're implementing, that lets them breathe a sigh of relief, positive or negative. Of course, if it's negative, if they come back with a negative result, meaning there's no COVID present, that is that's a really deep sigh of relief, because they know that what they're doing is working. And this is data that can actually give them visibility to that outcome. And if it comes back positive, it gives them hope, because it tells them that they need to take action. And when we have a really solid infection control plan, we know what action we need to take. And so the testing data is just solid information that tells you about that gives you that visibility that you do not have any other way, that otherwise you're flying blind, and you're making decisions without that solid data to support those decisions. So frankly, COVID was a wake-up call. We have been dealing with transmissible diseases for many years without really having the visibility to what is going on in our facilities. We're going to be needing to battle not just COVID, but other diseases like influenza and norovirus to make sure that we can keep people healthy within our facilities. And we also, have to face that some of these COVID variants may not respond to the vaccine. And so we need to be able to keep our eye on, keep visibility, know what's happening, and be able to test for these things so we can see what is going on in our facilities. So again, first layer, last layer of defense, that testing actually can give us visibility to all of these diseases before they become a problem. It also can test and tell us whether we're dealing with the original COVID or any of the variants of COVID. And so we can use proactive testing to maintain the health of our facilities and tell us what we need to do in order to protect them, and tell us what the risk is in our facilities. So what does that mean for you? So it means that having a comprehensive infection control plan is critical. And it's not just critical for COVID for today, it's critical going forward. And so if you don't have a comprehensive infection control plan, then you should. That should include these many pillars of an infection control.
Dr. Shula, can you repeat that? You went
sorry,
out.
Can you still hear me?
We can, but we just lost what you just said.
Oh, sorry. Can you still hear me? Okay, great. Sorry. So, all of these different pillars are important: screening, appropriate PPE, and of course, creating a culture in our facilities of infection control. And then wrapping that all with testing, whether it's human testing or environmental testing, making sure that we are collecting the data so that we know what's going on in our facilities and taking care of them. And of course, vaccinating as vaccines are available, and then making surveillance a priority and making decisions based on that surveillance data. And so what does that look like for Enviral Tech? So going forward, we're offering a broad surveillance plan that includes influenza, norovirus, other intestinal pathogens, and emerging viruses as they come about. So we're really trying to provide that protective wrap so that you can feel confident knowing that your facilities are protected. So I thank you so much for your attention. I'm happy to answer questions. You can either ask me here, you're welcome to email me as well. And so I'll open it up.
Thank you, Dr. Jaron. If you could stop sharing your screen, I'll be sending out an email, as you all know, on Monday with the links and everything. But we had quite a few questions while you all are trying to wrap your head around everything. We had quite a few questions in the chat that I'd like to
Okay.
share with you. The first one was, are HEPA filters beneficial with air purifiers and reducing COVID-19 particles?
So I'm assuming that you're talking about the HEPA filter, the movable HEPA filters. Yes. And so my colleagues at the University of Oregon study the sort of air, how diseases spread through the air. And in their work, they have shown that HEPA filtration helps. So those movable filters helps a ton. It's not, it's not complete, but if that's what you have, if it's too expensive to install new HVAC systems in the facilities, that is actually a really good stopgap.
Caitlin, I hope that answers your question, but feel free to chime in if you want more elaboration on that. And then Stephen, if you want to ask the question, I'll let you ask it.
Sure, and I know you don't disinfect planes, but I was wondering if there was any correlation, because we're talking surfaces and air and HEPA. I was just on a flight recently, and luckily it was a brand new plane. He said air exchange was like every 2 to 3 minutes, and they have new HEPA filters. I felt very comfortable on the plane, but I was wondering if you had any news on just air travel.
So I don't, unfortunately. I've read a bit about it, and I think that the air, the way the air circulates on planes, I mean, they're sort of ahead of the game. They've always been ahead of the game of everybody. And so my understanding, and what I've read about it, is that the air on planes is actually pretty safe, but that's not my area of expertise. I will just say that caveat.
Yep. Okay,
Fair enough. Thank you, Stephen.
Yep.
And then Mikkel had a question. Were you able to determine if most facilities you worked with were using the appropriate surface cleaning products? That's first question. And then I'll let you answer that one, then I'll go into the next one.
So it's been very interesting. There's been a mix of what's working and what's not in facilities. And so most of the facilities that we work with do use good cleaning products, but what typically happens is we've seen that we've been able to identify those facilities that aren't following the cleaning protocols the way they were set out. So, we've had a couple of cases where a company might have, 15 or 20 facilities, and most of those facilities are following the appropriate protocols, and then 1 or 2 are not leaving the disinfectant on the surface long enough. They're not doing the wiping, and so that's been where the surface testing has really helped them, is to identify those outliers so that they can take corrective action.
And then her second question was, what was the highest area of opportunity your company identified with regards to infection control for the facilities overall?
That's a great question. Let me come back to that, because that's not something that I've really spent a lot of time thinking about, actually, the highest area of opportunity. I think for most of the facilities, infection control overall has been a lower priority. And so they've had to update protocols. They've had to really look for expertise in the field so that they are using, the right masks, the right protocols, et cetera. And so I think that's been a pretty big opportunity for most of the facilities.
Okay. Mikkel, let me know if that answered your question. And then she said, thank you, Dr. Jaron. Very informative presentation. So there you go. The answer was answered. Alden Rice, I saw you came visible. So if you'd like to ask your question, go right ahead.
All right, thank you so much. So Shula, or Dr. Jaron, I toured a new community that's opening up here in the Virginia area, and the marketing person was just totally so excited about this paint that they had painted the building in, and said that whatever, there's some ingredient in the paint that will repel any sort of bacteria or germs from attaching. And that was the first I'd ever heard of that. I didn't know if that was just like some great brainchild that had come out of COVID. And, you know, Sherwin-Williams jumped on that and was like, hey, let's market this. And does it really work? And do you know anything about it?
So I think those paints have been around for actually a while now. And there are different coatings that people have developed to repel different pathogens, bacteria and others. And so we haven't personally tested any of those. I have to assume that they work to keep things from growing on them. How well they keep, you know, ultimately COVID, when we're dealing with COVID, right, we're dealing with something that's transmitted through the air. And so for us, as I tried to explain at the beginning, like, we're testing surfaces as a tool to tell you what's going on in your facility, but not to tell you whether or not the surface is infective. And so whether or not those paints on surfaces help with the air transmission, I don't think anybody's really tested that.
Okay, thank you, Alden. Another question from Susan was, when using bleach, what is the proportion of the bleach solution? Not full bleach, correct?
Yeah, it's 10%.
10%.
Yes.
Does that help, Susan? Okay, and then Charles had a question. Do you have an opinion on HVAC ionization and UV treatment?
I think I'm going to punt on that because my colleague has a study that he's in the middle of with both the ionization and the UV treatment. And so we're kind of waiting for that data to come out to see how that, you know, what the impacts are. I think with UV, my gut says that, you know, UV does kill the virus, but it needs to be, you need to expose it to UV for a certain amount of time. So as long as you're having that exposure length, then it's probably working. I've seen some UV solutions that I don't think actually expose long enough. And so I think there's both like my gut feeling, and then there's some data that will be coming out this spring that I think will really answer a lot of those questions.
Okay, so Charles, you're on the right track, it sounds like. They're trying it, they're testing it. And then Anne had a question. What is the proper way to clean surface when wiping it down? If you use something to wipe, shouldn't the surface be wiped in one direction rather than back and forth?
That's a great question. So in our experience, the back and forth doesn't matter. It's really trigger spraying, letting it soak for a certain amount of time, and each cleaner has the EPA has listed like the length of time you should let it soak for, and then wiping it down.
Okay.
And so back and forth is fine.
I have sometimes noticed that people cleaning went back and forth with the same cloth. Wouldn't it be safer to use spray and let it dry and not wipe the surface at all?
So if you want to remove the virus from the surface, you have to wipe it. So trigger spraying and then leaving it to dry won't actually, it may kill the virus, but it won't actually remove it. And so if you're concerned about removing the virus, you need to actually wipe it.
Does that help, Anne?
Yes, it does. Thank you.
And then Susan had another question. I think I heard you say something about the time spent in wiping surfaces. What is that? So where is the EPA listing of how long to soak the various cleaners?
So the EPA, if you go onto the EPA site, each cleaner has a different listing, and so it'll tell you for that particular cleaner how long you need to. So there's so many on the EPA website. I don't have them memorized, but they're all listed there.
Shame on you. I'm just kidding. I'm kidding. Doctors are allowed to take a break and not study everything. That's why there's a website for all those things. Does anybody else have any prominent questions? Because this is some really valuable information, and you have her here at your disposal for a few more minutes. So does anybody else have any other questions or want to chat it by any means? Anybody at all? Okay, well, usually when I turn off the recording, sometimes there's more questions. So let me turn that off.